Hi, good evening, everybody. Welcome to Community Focus here on Channel 6 TV. I'm Kenny Fogle, your host. We're glad you could join us tonight. We're going to talk about something that, well, most of us hope we'll see someday, but if we live long enough, and I'm approaching that area now, let's talk subject of Medicare. And we got Margaret Neal here with us from the Nelson County Community Clinic, and she works with this kind of stuff all the time, so we're going to pick her brain a little bit. First of all, Margaret, welcome to the show.
Thank you. Thank you
for having me. I'm glad you could be here. And I know, before we even get started, I know you're already gearing up, and Medicare open enrollment's not even until this fall, and you're already, here it is, April, and you're already working on open enrollment and coming up in, October.
Right. We're trying to get some volunteers and able to help us because it is such a complex subject, and it takes a lot of time. So we're having some training sessions at the Nelson County Public Library. So we've got 3 training sessions going on. So the first one is tomorrow. So we're trying to get.
Now, why is this such a complicated subject? I mean, what is it? I mean, I know the basics. I mean, when you turn 65 years old, you qualify. Medicare is an insurance. Okay, how much more do I need to know?
It's not,
we got a long time here in the field, don't we?
It's not one size fits all because it's different for different people. So I can basically tell you the parts of it, like Medicare A and Medicare B. Medicare A is your hospital, and it's free to clients who have worked enough quarters, and your Medicare A is your hospital, and usually that pays 80% of whatever your hospital bill is. Okay, your Medicare B is your doctor and your outpatient visits. And now the new monthly premium this year is $134. So that covers, like I said, the doctor and the outpatient visits, and it's at 80%. So if you don't sign up for Part B and you're going to continue to work and you have credible insurance coverage through your employer, it's best that you don't sign up right then when you turn 65 if you're going to continue to work on, because if you do, they're going to charge you $134 for your premium each month. So if you've got credible coverage and you continue to work, so just delay that and continue using your employer's insurance. So when you decide to retire, then that's when you can sign up for your Part B, and then you start.
Part A starts when you're 65 regardless.
Part A, and it's free.
So that's free.
But yeah, so you're okay with that. Yeah. So then also when you turn 65, you have like a 7-month window, and that 7-month window is like, it's kind of like a guaranteed right to purchase a supplemental plan. And a supplemental plan covers Part A and Part B at 20%. So your doctor, hospital, and your hospital, your doctor, your outpatient visits, that covers, the Medicare covers 80%. The supplemental plan will cover the other 20% of that, which makes you covered pretty much at 100%.
Right.
Okay, so that's the supplemental plan. All right, so then you also have Medicare Part D, which is for your your prescription drugs. All right, that plan, you have to pay a monthly premium, plus you have to pay your drugs whenever you go to the drugstore, or whatever your copay is. So what we do at the clinic is we take your drug list and we plug it into the Medicare.gov website, and we can look according to, and we put your zip code in. We can look at all of the plans that's in this area that would best fit you according to what medications you're on. If your husband's on one plan, a drug plan, and you want to be on the same one with him, that's not a good idea, because more than likely he's taking a different drug.
Every one of these program plans are different. I mean, like you said, they cover medications at different rates, or just some don't cover some at all, maybe.
That's absolutely right, because some of them are not on formulary, so that way we can look and see what is on formulary, and it may not pay it. If it's not, so then we look at a plan that will be suitable for whatever it is that you need.
Well, before we can move on a little further, Part B, you say you can delay that. How long can you delay it? Is there any penalty if you delay it to you're 75 years old? Or?
There's no penalty if you delay it, as long as you have credible insurance coverage.
As long as you have credible insurance.
As long as you want. And then whenever you retire, then you need to sign up for it then.
Okay.
And then you start paying for the
But
Part
the Part C, you have to do that?
Okay, now the Part C.
Well, that's the credible insurance, I guess, in a way, is it? Or
Part C is an Advantage plan.
Okay.
Okay.
Well, what's the part you just said you had to sign up in so many days after you turn 65?
That's your supplemental plan. If you're
okay, well, that's where you lost me.
Okay, I know I go too fast sometimes. Okay, so if you have Part A and Part B, and you're not working, you only have Part A and B at 80%. All right, so if you want something that's going to cover
I see what you're
20%,
saying. Okay. I got that confused with the Medicare Advantage then. So that's two different things.
That's two different things.
Okay.
So the supplemental is the 20% of whatever Part A and B doesn't cover, your doctor and your hospital. Okay.
Now you get that through the Medicare system?
No,
that's all private insurance.
That's it. That's right. You have to go through a licensed insurance agent to get that, and that would be someone, preferably that you know that is someone that you can trust, someone locally, if that's what you decide to do.
All right. But Part C. Now let's get into Part C. Now we're talking about the Medicare Advantage plan. Now that also can sometimes cover the 20%, couldn't it? Or how does that work?
Okay, the Part C is it's like some people can't afford a supplemental plan.
Right.
That's the best way to go is the supplemental plan, but sometimes supplemental plans cost you maybe $150 or more per month. Okay. But a Part C plan is cheaper. It just depends on what you want. Sometimes it could be like $50, it could be $80 a month. It doesn't matter. It doesn't, it just depends on what we plug in. So on your Part C, you can only get that if you are under 65 or you are a disabled person.
Okay, so if you're over 65, Part C doesn't even come into play then.
Well, I'm sorry, you can get Part C if you're over 65, if you want to, but it would be not as good of a plan.
Okay.
But your Part C is usually basically for disabled people that cannot get a supplemental plan because they're not 65.
Okay.
Okay.
Well, I'm gonna have to do a lot of learning on that supplemental and the Part C part because that's very confusing.
It's two different things. It's two completely different things, and a lot of people think that it's not, but it is. What it does on the Part C, it takes your Part A, your Part B, and your Part D, your doctor, your hospital, and your drug, and it puts it all under one umbrella, and it calls it Part C.
Okay.
But with your Part C, you have, and sometimes it might have a little bit of basic dental and a little bit of basic vision, but very little usually. But sometimes it does have that. But with the Part C Advantage, you have a lot of co-pays and you have a lot of deductibles. Like if you go to the hospital one time early in the year, and you have to pay a deductible, you go back in again in August, you got to pay a deductible again. It's like if you had a supplemental plan, you meet your deductible for the year and you're good. Yeah. It's not that way with an Advantage.
Okay, well I'll give you my example. I mean, when I turn 65 in a few years, I'm a retired military. I have TRICARE for life. What's that? Is that a Part C or is that what is that?
That is a separate insurance by itself. You're good.
I know it's good, but I'm just curious what I've got.
I'm not sure which one of that we have to do some investigating on, but you're in pretty good shape. I think your TRICARE for life, I don't know if it comes first, if it comes second, but you're in pretty good shape.
Like I said, I'm all confused about this because I know that some things you have to make a decision when you turn 65, and I guess that was a good thing to learn here today. On Part B, you can delay that as long as you got credible insurance for as long as you can. Well, that's something I did not know.
Yes, that's true. Also, on your Part B and your Part D, whenever you're eligible for these plans and you don't choose to take them, they can put a penalty on you. And your Part B, definitely they will put a 10% penalty per year, and it gets compounded each year. Your Part D, sometimes it's maybe, but more than likely you will get a penalty put on you also. That's from the Medicare.
That's if you don't have anything else, or that's just anyway?
That's if you decide not to take it.
Simply not to take it.
If you decide not to take it, they're going to penalize you.
Why would you decide not to take it? I mean, is there any Part D? Is there a cost of Part D?
Yes, Part D is the drug plan. So when we plug everything in, we look. You have a monthly premium, a monthly drug premium. It all depends on how much it's going to cost according to what drugs you're on. So it could be. I think some of the cheapest plans was like $15, but some of them can go way up to like $65 a month just for the premium only.
Really?
And then when you go to the drugstore, then you're going to pay to pick your copay to pick your drug up.
So there's not a lot of freeze. The Part A is really the only thing that you're getting that you're guaranteed, 80% in the hospital. Everything else you may have to take a little bit out of your pocket.
Right.
Okay.
Yeah.
So I can see why you have to have some training on this because it could get pretty complicated, and you want to make sure you pass on the correct information to people.
Right. And there's a lot of people that as we get older, we don't understand some things, and some people just they make it so complex. But also another thing I want to bring out, also some people have limited income and they don't know that they would qualify for extra help. Also, I have some guidelines of what they can make as a couple or as an individual and tell them whether or not that they would be eligible for extra help. And if you get extra help, it depends on what level you're going to get it on. It could help pay for your Part B premium, that $134.
Yeah.
That could mean a whole lot of money for some people that's on a limited income.
Right.
So it's possible that they might qualify for that. It could also help pay for your co-pays and your deductibles, and it could also help for making your prescription drugs cheaper. Because if you get help with your prescription drugs, it can be a generic, it's $3.30, and a brand name, I think, is $8.25. That's all you would pay if you qualify for that extra help. So we're able to, we can enroll you in that extra help, try to get you approved for that extra help, or we can also guide you and tell you if you are or you would not be eligible. So.
Okay, well, like I said, I know the federal government doesn't do anything simple. So what's training? You say now it's going to take place over the next few weeks. I know you got one tomorrow, but you've got several more coming up over the next few weeks, I believe, don't you, as
yes.
well? Now, if somebody needs to know that, they need to call you and find all this information out, right?
Yes, they could. And they could call me at 349-5991. The thing about the trainings that we've got, I've had it going for maybe about 3 weeks. One training builds on the other two.
Okay.
We've got 3 trainings. But I also want to let people know, last year we did a Medicare seminar just for people that was getting ready to turn 65 or anybody that wanted to come.
Yeah.
And we're going to do that again this year.
Okay.
Because a lot of people really thought that was very helpful to them. But they leave out there confused, but yet they can give me a call and, we can work
Well, that's
on
the whole idea. We're going to confuse a few people today, no question about that. But again, the key to it is there's help available.
Yes.
And people
free.
and free help available. People are not on their own. So if you're approaching 65 or you're 65 right now and wanting to find out what your options are, you might want to give Margaret a call there at the community clinic here in Bardstown. Now you do have an office there at the Nelson County Community Clinic.
Yes, I do.
So I know you want people just dropping in all the time, but there are drop-ins available probably.
There is. It's better if you call me and set up an appointment because I have so many people that come in that drop off stuff and I'm trying to work through that. But also, could I do a little other little plug? I just want to let people know that it is free to Nelson County residents who would meet the guidelines. Sometimes it could be that you could have insurance and your insurance won't pay for a particular drug because we also work with the KPAP program, which is a Kentucky Prescription Assistance Program. I have so many people that are on insulin that can't afford their insulin or their inhalers because the prices on them are really, really high. Yeah. There are drugs, pharmaceuticals that will provide those drugs to the patient free of charge until the end of the calendar year. There's a whole lot of paperwork to it that you have to get approved, but sometimes I'll type up a letter of hardship, but sometimes we can get them approved. I've got several doctors in town that know that we are doing this, so they are constantly sending people to us to try to get us to help them. So.
Well, it sounds like you got some mighty work going on there, and I'm sure you got quite a few customers. I mean, as far as
it keeps growing.
I'm sure it keeps growing all the time, and as people are aging and probably using Medicare a whole lot more. Now, you get into Medicaid any at all, or
no?
I know that's sort of supplemental at a certain point, but that's another confusing thing. People get Medicaid and Medicare mixed up sometimes, but Medicare is a service provided to people 65 and over. That's the way I understand it.
Yes, that's correct.
Okay.
And Medicaid, I think, is to income.
That's more income related,
and
right?
that's out through the DCBS office, Department of Community-Based Services. Okay. They work with that. So.
Okay.
But basically, what I work with is basically the Medicare and the Prescription Assistance Program. And then Paula Travis, our director,
right.
She does the other part. She does the medical clinic. We see medical patients, and she does the dental clinic. We have denture. We have a denture program, and we have an over-the-counter medication for people, drugs that are free. Yeah. So we got several services going on there.
Well, I know y'all have a lot going on because you're always busy every time I go by there. Yeah. But again, you're located in Bardstown. What's the address there? 300
West John Fitch, Suite 200.
Okay, so if anybody wants to stop in and check it out, but again, give them a call. We'll say 349-5991. Give Margaret a call, especially if you're getting around say age of 65 or so. I know I got there. I'm headed that way. We're all headed that way. Hopefully we'll get there in the next few years. And but it's a good time to find out because it changes every year, doesn't it?
Yes, it does.
I know there's little changes every year. Premium every year goes up.
The Part B premium went up. So yes.
Well, it usually goes up about the same level of Social Security, I think. They try to keep it about the same, I believe.
Well, they tell you that they're going to give you a little bit of a raise, but then they turn around and raise the premium, so then you don't really get a raise.
So Part A is free, Part B $134, Part D depends on the insurer that you and you'll work work with people
Yes,
on that?
I'll work with them according to the drug that they're on, and then the insurance company.
Because I know because people tell you all the time, go online and do this, and I know some people try it themselves, but it's not as user friendly as they try to make out like it is in these TV commercials. So, so that's why we have people like you in there to help plug these things in. And again, bring a list of your drugs, and most people know what drugs they take, and it's amazing that it changes from one insurance to another.
Yeah, and if they want to call me, I can send them out a packet. It's a real easy packet to fill out. That's what I usually prefer to do, send out that, and then I'll put in a note in there what I would like for you to turn back into me, and then we can go from there. But I've got several people that are helping me, that's going to be helping me more this year. Last year was quite a bit.
When is open enrollment? Sometime in October.
October 15th through December 7th.
October 15th, December 7th, and prior to that, or around about that time, is when you're going to be having sort of a seminar of some sort?
Yes, we're going to have another brush up in the fall, right before we get ready to start. Then plus we're going to have an open enrollment day at the clinic. We had it last year, and we scheduled it from 9 to 2, and it went the whole 9 to 2. So this year, I don't know if I'm going to have more than one day or not, but we'll see.
Right, well, give Margaret Neal here from the Nelson County Community Clinic. We're talking about Medicare. So like I said, if you're around the 65 age group and you want to know more about it, give her a call at 502-349-5991. It's 349-5991. Margaret Neal, give her a call, and you'll find out everything you need to know about Medicare plus a little bit more. So thanks. Appreciate you being here today. It's certainly, like I said, I've learned a lot here today, and I hope other people have too, because it's a complicated thing, but insurance is something we all need, and again, it's a good thing we have people like Margaret around to guide us through these red tape. So stick around, a lot more to come here on Community Focus. We'll be right back right after these words.